And it is really a privilege to meet you and inform you about Christian Aid's work in Ethiopia and the project we are implementing with your support. Christian Aid started working in Ethiopia during the emergencies of 1970s and 80s, and subsequently establishing an office in Addis Ababa in 1998. We have reached over 1 million people in Ethiopia, both on humanitarian and long-term development support. Climate change-induced disasters such as recurrent drought and flooding are currently adversely impacting the health and lives of people in Ethiopia. Increasing incidence of climate-sensitive diseases such as malaria, meningitis, diarrhea are some of the main climate-induced diseases. Each year, Christian Aid works hard to strengthen resilience of the target community and the capacity of health systems to address health emergencies by supporting them to predict and detect health hazards before they reach disaster phase, and to act as quickly as possible as they occur. And the project we are implementing with your support has a major component of climate change and health. And we are implementing this project in partnership with Ethiopian Meteorological Agency and Ethiopian Public Health Institute, as well as our partner on the ground, Action for Development. Christian Aid has a long-standing partnership with Action for Development. And they are active, they are popular on the ground at local level. They have a very good relationship with both communities and with the local government. They have good understanding of the local context. So that is why Christian Aid is actually, working directly with Action for Development on the project you are supporting, and also other humanitarian and development related projects. So with this, I would like really to conclude by extending, our sincere thanks for all your support to the cause of Christian Aid in Ethiopia.
My name is Noai. I work for Action for Development. Our organization is working here in South Omo for more than 20 years. When we are working here, the people of South Omo is more than 800,000 people. Most of them are marginalized, and the people are affected by different climate-related impacts. For example, drought, flood, desert locusts, cholera, animal health diseases, human health diseases are the most hazardous and the most challenges that are suffering the people. To support specifically to this, the health system or the PM system, we designed this project because most government health forces, health center, and the health organization has suffered with different shortage of equipment and as well as capacity shortage, logistics shortage. To fill this gap, we designed a project that we implemented for the last 1 year, and the project has remained with 1 year. So in the last 1 year, we have implemented many activities, for example, distributing disease surveillance reporting formats. We have strengthened the rapid response team of the districts. We strengthened the health task force, and we also provide emergency drugs for health posts, health centers, as well as the districts, including construction of water schemes. We construct one water scheme in one area, so that's public. The water system has 4 public water points, and the water is used for many people in that area. In this project, we have been implementing one water scheme, one big scheme. We cap a spring eye, and from the spring eye, we store the water into 25,000 liter capacity reservoir, and after that, we constructed 4 public water points for the people as using a faucet or a tap. So yes, as the supporter said, the sustainability issue and the maintenance issue is a problem. So to reduce these effects, we trained water management committees for this scheme. This water management committee is responsible to manage the water scheme in safe manner, and the people of that community, when we constructing that water scheme, are participating through labor, because they are very interested to use that potable water, because before that they were affected by waterborne diseases, and especially diarrhea and cholera.
So the Met Office, in partnership with the Ethiopian Public Health Institute, are currently doing a research piece that's funded by the project, that's looking at identifying disease outbreaks in the project area that are related to climate. So outbreaks of, which ones are the most prevalent? That could be cholera or measles or typhoid and so on. So they're conducting this research to see what outbreaks are coming up in the area, and then they're developing from that ways of identifying these disease outbreaks early on, so that we can very early on tell, okay, at this climate or at this temperature, this disease is more likely to occur. And also what are the key identifiers, so that we can capture the outbreak very early on. They'll then write up a report, I guess, on that. This is all being undertaken at the minute. It's should be finalized at the end of the year. And then their findings from that research piece will be shared back with Action for Development and Christian Aid Ethiopia, who will then be able to help share this learning with the Ministry of Health and disseminate, share their findings with the Ministry of Health, who in turn can then have the knowledge, and they can put that into practice through the structures that have been developed within the project. So that's through the reporting systems that we have, the linkages that we have between the different levels of health centres, health clinics, right down to, as Degefu was saying, the community, the health defence armies who are literally out there meeting with individuals every day, so that hopefully we can stop outbreaks happening very, very early on. To the project in some ways, that on the one hand, we're doing this research piece that will really be for the longer term, really useful for the longer term. Also in the more immediate is what Action for Development are doing on the ground, and what we'll hear from the community at the minute, which is ensuring that the drugs are in stock, in store, that the water, okay, it's a small element, compared to the need, but it's still going to reach, I think Niwai can tell us how many people will be reached through this protection of water springs and provision of clean water. So the more practical elements, as well as alongside the strengthening of the reporting structures, so that, the outbreaks of diseases are reported very, very quickly and captured very quickly, and from the health defence armies right up to zonal level. And then on the other hand, you've got information being passed from the higher authorities within the Ministry of Health, can be passed very quickly down to the health defence armies, and then in turn the community. So that if there's an alert coming from the zonal level, it can very quickly get down to back to the community. So if that whole system, that chain is strengthened, and they're able to report and communicate and link well with each other, the community might say, okay, we've got this outbreak of disease. Then at the higher authority level, they can be ready to distribute the correct drugs in a timely manner. And likewise, if at the higher level they're saying, okay, we're seeing that they're, given the climate situation and this research piece that we've done, we can see that it's likely there's going to be an outbreak of this disease at this time of year, and they can predict that, then they can also make sure that the correct drugs, the correct healthcare support and so on is being channeled back down to the local communities. So if that whole system is strengthened, then there shouldn't be so many blockages along the way, and timely support should be given. That's from what I've seen and what I understood.
We do have community groups which come from the community, health development armies. This her name is Masari. Her name is Masari, and her name is Kashin. They represent community health development armies, and they came from the community. They have role to disseminate the information to the community, and they are the representatives of the community.
That's in that meeting on I know in a pair of bonus. Bonano Indian, Keda, any by Indian and near Sand. Or no one ever. Os Davan of Los Banking down. No one, you don't need to hear my easy reality. Take it. Or no cut him, but no pain in the she. No. Then I did.
Okay. It has been, according to her, it has been low rate for the past few years, and it creates the low food, and they have never done this agriculture the past few years, and it also leads the woman to go 5 kilometers to fetch water, which means it gives burden for women getting water, and it's also there is no farming, which creates a shortage of food in the community, as well as the high level. So the woman has to go far to fetch water, and it creates extra burden to the woman.
No one says as Koro, Algobar, Dagata. Agapala, Jura, no one Ashke, I'm thinking, no one of what Ole, I might say, Algo ship here, we import, I might say,
So what leads her to be volunteer in this project or to work with that stuff? She said that she's a part of the community that are facing these problems. So being involved in this voluntary system will allow herself moreover to the community benefiting that. And she found it very interesting that so this scheme is very helpful for the community as well as she's a woman, as a whole householder. So as a whole, it helps the community, her family, our whole system. So it motivates her to be in the scheme. Due to this shortage of water in our community, the place called Aluba, and due to this, they go further to fetch this water, and it's not only the water, it's also create people from the community has been sick cholera last time. This is one event that we are facing. So she wants to express that too.
what is that signal? Channel that we I might away to get a wound.
Okay.
Yeah, they correct the Nianka, I'll do that. Yes,
As she said that when it's happened, they are just as a health army. They said that they announce and create awareness and inform to the health center, and they highly participate in the community to get aware and then get medication from the higher level. So they just go to inform the community as well as to the health center to speed up and get aid for a drug. This is what the role they have done in that system when cholera happened.
ያው ይሄ ፕሮጀክት እኛ ጋር ከመጣ በኋላ በጣም እኛን የደገፈው ምክንያቱም
የሚከሰቱ በሽታዎች በየጊዜው ለእኛ ስልጠና እየሰጠ እኛ ደግሞ ልማት ቡድኖችን እያስተማር ልማት ቡድኖች ደግሞ ህብረተሰቡን እያስተማሩ የበሽታው ምንነት ምልክቶቹ እንዴት መታከም እንዳለባቸው እኛ እነሱ አስረድተን እነሱ ደግሞ ህብረተሰቡ ራሱን አውቆ የበሽታው እንዴት መከላከል እንዳለባቸው ትምህርት እየሰጠን ነው።
Okay, currently she would like to thank you this project and we are highly collaborating with this project, and this project has been giving her lots of support, like giving them the training how they can handle with health army and also in a higher level, and so they are supporting us doing lots of training, not only for the health extension or health army, and they also provide us drugs when the emergency are happening. So this is few things they are helping, but they are highly helping us in capacity building and this providing us drug for the community, and she would like to thank you about it.
Christian Aid Ethiopia office is in Addis, but we also have a field office in Jinka, which is right in the center of the communities that this project is working in. And Action for Development are also based in Jinka and have staff based right in the communities that we're working in. In fact, I think I missed the name, but one of the extension workers, he'll introduce himself again in a minute, is based right there in the community at the health center, at the health post. So they're very aware of the challenges and very ready to respond on the ground immediately. It's not that our project staff and the partner staff are based in Addis and we're trying to coordinate from 900 miles or kilometers away. And then in terms of getting drugs from Addis, out 900 kilometers to where the project is, you're right, that's a real challenge, and that's why we're implementing the project, is because we've seen that these drugs get caught up at the higher levels in Addis, and the Ministry of Health at the national level maybe aren't aware of what is going on in the project area in the southwest, and they're not hearing that there are outbreaks. They're not aware that there are outbreaks of disease going on because the reporting system is not there. So the communities are left to struggle and manage by themselves. But the point of the project is to be able to strengthen those systems so that when there is an outbreak, it is reported quickly up to a national level, who are deciding on budgets, deciding where to distribute the drugs, and so on. So if we can strengthen that system so that they become aware of what is going on, then they can distribute right down to where it's needed in these communities.
As I mentioned to you, his name is Johannes, and his name is Yamatawa, and his name is Hussein. They are public health system representatives, and if you can ask any question, and they will present and respond answers for the question.
Just with Action for Development, we provided training for Warada Health Officer, RRC team, the Rapid Response teams, especially the project area is in 2 Waradas, so that after giving that training, they have a good outcome or immediately seen, because at that moment there is an outbreak of measles occur in the Barnas. This team is go and just how to handling and reporting, how to strengthen the surveillance system, how to creating awareness for the community. Just these things were strengthening, and just after a few days, just the outbreak is easily they are controlled. So the one is this. The other one is training given on vaccine preventable diseases like measles, FPV, and other diseases, so that this training also creates for community immediately for detecting and reporting and responding of the disease. The other one is, there is a sensitization training is given for higher officials, especially the task force members, which was led by the zonal administrative chief and the member of the zonal administrative cabinet members. So this has a great impact because they have get awareness, and then the politician can be involved on emergency situation, and just they are regarding to involving and controlling the diseases and the other things, so that we give it. The other one is, they are purchasing drugs, especially donating drugs for the emergency situation, especially for the tourists. This drug also, because currently the government have a shortage of drugs, and there is a budget scarcity, so that they fulfill these gaps, and they donate. This is a great opportunity for us.
Vaccination is given by the local government. That means the health system is led by the local government. So health system, the local government gives the vaccination. But the project role here is supporting the system. That means in skill or in knowledge, as well as in providing these reporting materials that means to produce the report, to increase the report quality. If, as I mentioned previously, there is standardized operational guidelines nationally produced. So if those standardized national guidelines are not reached here, if it is not reached here, the reporting system may miss the quality. So we avail, the project avail the reporting system parts, or strengthen the knowledge and the skill of the public health workers, as well as the health extension workers, especially in identifying the cases, that mean the incidences that, as you mentioned, that may be measles, that may be cholera, that may be malaria. So the project capacitates the health system workers to identify the cases, but the vaccination is given by the local government.
No, just to say a big thank you to everyone who's travelled from the communities to come and the health centres to come and talk to us. It's been really helpful to hear and interesting to hear, even for me. And again, thank you to the supporters as well for joining us and showing interest and being keen to hear more about the project. It's really an honour to share more about what's going on and about what we're doing. And I think I mentioned earlier, I was lucky enough to have the opportunity to travel myself to visit the project in July, a couple of months ago. And I wish, it's great that we've been able to do this virtually, but it would have been wonderful to have had you there with me, meeting people and seeing it for yourself in person, and to try and convey the sights and the smells and the experiences. We're never going to manage that fully over the internet, but it was really incredible to see this kind of contrast of dramatic and beautiful kind of landscapes and the warmth of the communities and the people that I met, contrasted with the real dire need within the communities, and the stories that you're hearing of malnutrition and of disease outbreaks, and no rain for 3 to 6 years and dried up riverbeds. It's a real contrast. And it's very easy to, I guess, to have looked around as, even just driving through to get to visit people out in the community, to have this kind of sense of doom and what can we do? Look at the landscape, look at what's happening, look at the immediate need. But for me, it was really inspirational to then actually get and talk to people who are being impacted by the project, and to hear, yes, the immediate things that the project is doing to alleviate the needs, the water sites that are being protected, the drugs that are being provided, the training that's being provided, and how that's meeting the immediate needs. But for me, what really excites me and inspires me about this project and about ITL as a whole, because this is one of our key aims of ITL as a whole, is to look at the longer term impact that we're having in the community and how we can scale and make it bigger, than just remaining and meeting, a couple of hundred people's immediate needs. What are we doing that can have a longer term and a much bigger impact? And that's what really, really inspired me about this project, and about how, when we finish the project next August, it's not going to go back to how it was. These health systems, they've now got the tools and they've got the capacity to continue to. It's been strengthened. That will last longer term than than a water site being protected. And so on. It's going to have a very long-term impact, and the research piece that we're doing can be scaled across across Ethiopia. Once we've identified some of the thresholds for identifying disease outbreaks, that can be shared not just within southwest, the project area. It can be shared much wider. So that really has inspired me, and that's really one of our aims of ITL as a whole. And the other thing that just really inspired me as well was, for me, the commitment from the communities and the commitment from the local Ministry of Health to serve their community and to implement the project and see the project achieved. And I think one of the Health Defence Army members mentioned earlier, you heard, I think it was Kashir mentioned earlier, was that the reason why she wants to be a Health Defence Army volunteer is because she lives in the community, she's part of the community, and she wants to be part of the solution. And I think that's exactly, again, what we're trying to do with this project and with ITL, is recognise what's already in the community. We've got people who are, they don't want to sit around and wait for external help. They want to be part of the solution. We've got a health structure that's there. We're not creating something new. The system is there. It's just very underfunded, under-resourced, and collapsed to some extent. And what we're trying to do is take that system and to strengthen it and to build it and to revive it. So for me, that's really exciting, is seeing what do the community already have that we can build on and strengthen, and they can be part of the solution. So it's really, really exciting for me to be part of that. I hope that as supporters, you also get a sense of that excitement, that you're part of something that's making a long-lasting impact, and you're part of the solution as well, hand in hand with the community. So yeah, a big thank you again to everyone for joining, and it's exciting to me to be part of. I hope you get that too.